Ласкаво просимо. We are very pleased to welcome you all here during this second introduction event of a brand new series of webinars for healthcare professionals. This series is run jointly between ERN EUROGEN, OMNI-NET Ukraine, and the International Federation of Spina Bifida and Hydrocephalus. We are here together to improve treatment and achieve better results in multidisciplinary care of children with special needs. And to our Ukrainian audience, у разі повітряної тривоги просимо вас негайно перейти в укриття. Перегляд запису вебінару буде доступний згодом. In case of air alert, please go to the bomb shelter immediately. This webinar is recorded and will become available shortly. And now, I give word to today's co-moderators and speaker, Professor Giovanni Mosiello. Professor Mosiello, the floor is yours.
Okay. Thank you very much, Dr. Zymac. I'm very pleased and proud to be there, to have this opportunity to share with you our experience. I'm Giovanni Mosiello. I am pediatric urologist in Bambino Gesù Children's Hospital in Rome, and I am the chair of the Trans-ERN working group on Spina Bifida. This Trans-ERN working group has been established between our ERN urological ERN, the EUROGEN, with the neurological ERN ITHACA. And I co-chair with my colleagues, Professor Jean-Marie Jouannic, that is a gynecologist and is the head of a Spina Bifida Center in Paris and in France, and is also the coordinator of the French net for Spina Bifida. With us, we will have Dr. Natalya Zymac, that is a genetist, and he works in Klementinsky City Children's Hospital in Ukraine. And I believe that this opportunity will be in the next webinar, could be very useful in order to share our experience. Why? Because we know that as soon as possible, Ukraine will be with us in the European Union, and we will have more opportunity to work together. At the moment, we are working together on some emergency situation because we are receiving some children by Ukraine, and we are trying to cooperate for these children. We start this cooperation that is an opportunity to knowledge each other, but I believe and I hope that as soon as possible we will start to work together on clinical program, on research program, on academic program with you in the European Union. So I believe that we can start with the webinar of today, and the first presentation will be by Professor Jean-Marie Jouannic, and introducing mainly the ITHACA aspects and the cooperation with the EUROGEN and the aim of our Trans-ERN working group. And my presentation will be focused on the next topics that we will discuss during the next year. We will start with a technical webinar in January, and then Dr. Zymac will present some aspects useful to know about the future cooperation, the Ukraine situation, and how to join and how to share our experience. And the topics that we have selected is a part of the topics that we have to discuss, that we have to share as experience. And of course, I hope that we have the opportunity to follow with other meetings. So please, your suggestion will be welcome and very useful to improve the interest, because we are working together and everyone is useful to increase the success of this project. Thank you very much. I believe that we can start with the presentation. Yeah.
Good morning to all of you. Before I start, I would like to express my admiration to you and your people for your courage in defending your country in this war. Let me start by introducing myself. I am Professor Jean-Marie Jouannic. I am OBGYN at the head of the fetal medicine department in Trousseau Hospital in Paris, which is one of the largest French hospitals for children. I am the coordinator of the French National Referral Center for Spina Bifida. And I am very pleased to be here today to give you a presentation on the Spina Bifida working group that we coordinate with Professor Giovanni Mosiello from Rome. This group brings together around 50 doctors and patient representatives who are involved in the care of patients with spina bifida and other dysraphisms throughout their lives. This care can begin as early as fetal life, with the possibility in some European countries of carrying out prenatal repair for this malformation. This group brings together specialists in fetal medicine, urologists, re-education specialists, and also neurosurgeons. The working group has been renamed recently SBOD for spina bifida and other dysraphisms, which indicates that our working group is not only dedicated to spina bifida, but also to other dysraphisms. As you know, spina bifida can be diagnosed prenatally by ultrasound. This diagnosis can sometimes be suspected at the first trimester scan when an unusual aspect of the posterior fossa is suspected, as you can see here, with a diagnosis that was suspected during the first trimester scan with an unusual aspect of the posterior fossa with the disappearance of the fourth ventricle on the sagittal section, the section on which we can measure the nuchal translucency, and also an obliteration of the retrocerebellar fluid spaces. This diagnosis is more often suspected during the mid-trimester scan with indirect cranial signs that are represented by a flattening of the frontal bones associated with an abnormal aspect of the posterior fossa, giving the appearance of carry to malformation. You can see here indirect signs at the level of the skull and the brain. At the right part of this slide, you have control, a normal aspect at a similar gestational age. And these indirect signs are the flattening of the frontal bone that you can see here, and the typical aspect of the posterior fossa with the so-called banana sign corresponding to the carry to malformation. On the sagittal view, you can see here the typical aspect of the anal carry to malformation with a descent of the inferior part of the cerebellum through the foramen magnum. There are two types of Spina Bifida, meningocele that you can see here with, on this sagittal view, we can see that this is a cystic lesion that is filled with cerebrospinal fluid, and you can see within the sac the nerve roots. On the axial view, you can see that the posterior laminae of the vertebra are everted. You can see a control at similar gestational age with the normal aspect of the posterior vertebral lamina. And on the coronal view, you can see the typical aspect of the placode that is represented by these two hyperechogenic bulges corresponding to the placode. On the right side of this slide, you can see a case of myeloschisis. In myeloschisis, the direct signs are often underdiagnosed due to the absence of cystic lesion. So in this malformation, brain and skull anomalies are key findings that lead to a precise examination of the spine. You can see here an abnormal eversion of the posterior vertebral laminae, and the placode can be seen here on the coronal view with, once again, this typical aspect of two hyperechogenic lines. In Europe, the prenatal diagnosis of open dysraphism is high, and depending on the legislation of each country, a termination of the pregnancy can be performed at the request of the patient if it is the wish of the patient. In France, and you can see here the results from the register from Paris, the diagnosis, the prenatal detection rate for Spina Bifida is over 95%, and the rate of termination in France is also pretty high and is around 90%. For women who wish to continue their pregnancy, several European countries offer the option of prenatal repair. Currently, there are two techniques that can be used to perform this fetal surgery. The open surgery, which still represents the gold standard for the prenatal repair of MMCs. And another option is to perform a fetoscopic repair. And in both cases, the fetal surgery is organized before 26 weeks of gestation. The approach to the perinatal management of Spina Bifida has been interesting because it has led us to think to a new method to try to be as precise as possible to describe a dysraphism. And this is, of course, very important because there is the option now for a fetal repair, which means that we need to be as precise as possible to characterize a dysraphism and to consider if a case is eligible or not to a prenatal repair. And an update of the classification of dysraphism has been done by the SBOD working group. As you know, the European OMNI-NET Consortium, which has been in existence for over 20 years, has established classifications for all developmental anomalies. Our group was tasked to make this revision and to deliver a resource that fits the task of coding patients. Over the past 2 years, this work has been done and was led by Ferdinand Dombe, who is an expert in this field, and by Timothée de Saint-Denis, who is a pediatric neurosurgeon. During the past 2 years, we have proposed to try to describe all the human dysraphism disorders using a combination of findings that can be cutaneous finding, bone findings, and also spinal cord finding. And the update of this classification was validated during 3 consensus conferences that were organized under the auspice of 2 ERNs, ERNs ITHACA and ERN EUROGEN. And these consensus conferences gathered around 30 experts, European experts in this field using Delphi-type methods. The work of our group is not limited to the perinatal management of cases with spina bifida, but we are also trying to establish guidelines for the management of patients with spina bifida during childhood, at the age of transition, and during adulthood. And here is the urological guidelines that was conducted by Giovanni Mosiello, and that has been finished a couple of weeks ago. And finally, a very important task for us will be to establish a mapping of the European centers that can offer multidisciplinary care for patients at all stages of their life in Europe. This work will also, of course, be carried out with the help of patient associations. As you can see here, there is a very good mapping of the centers in France, and we want to do the same for all European countries to facilitate the access of the patients and their families to specialized center. I hope that this summary of the task of the SBOD group has been of interest to you. And to finish, I would like to reiterate that our hearts go out to you in the face of this war, that your people are facing with a lot of courage. See you soon. Bye-bye.
Dear all, welcome to this webinar on spinal bifida multidisciplinary management. First of all, I would like to thank you for what you are doing for whole Europe. Thanks. I am a pediatric urologist. I work in Rome Bambino Gesù Children's Hospital. I am director of the Division of Surgery for Continence and Neurology. I am a director of a certified training center for pediatric urologists by European Society of Pediatric Urology, European Association of Urology, Société Internationale d'Urologie. In our hospital, we perform more than 30,000 surgical procedures every year, and in my division, more than 1,800 surgical procedures every year. Actually, I am the president of the Italian Society of Pediatric Urologists, panelist of International Consultation on Incontinence, member of 2 committees of International Continence Society, where I was for 6 years the chair of the Children and Young Adults Committee. I am the coordinator of Disease Area 1.4 for the ERN EUROGEN, area that includes several diseases, including spina bifida. And the spina bifida is a sharing management with the colleagues of ITHACA. We have the same aim to improve the care and the cure of people with the spina bifida. And these are our aim. Professor Jean-Marie Jouannic is co-chair with me, and he is the coordinator of the French National Center for Spine Disease in France. We have some task force teams that are working on pediatric urological guidelines, fetal surgery, orphan code classification. And we are going to start other activities on guidelines on urological, neurosurgery, radiological, rehabilitation, research projects, and defining the standard of care, mapping the center, education exchange program, and this project for support Ukraine. We organized different workshops in the past year. This one was the past one held in Krakow in Poland in June. And we had the honor to have someone of you to share our experience and knowledge. And this is the project of the webinar on the spina bifida that we have defined with your colleagues. The first one will be focused on the neurosurgery, on the pathophysiology, classification, and neurosurgical management by 2 neurosurgeons, Professor Timothée Saint-Denis and Dr. Giacomo Esposito. The topics will be discussing on controversies on tether cord and tether management of this patient, when to perform surgery, how to classify the different forms of spinal dysraphism, and how to classify according to the new ORPHANET classification. According to this, it's very important to define high risk or low risk population for neurogenic bladder. And the following webinar will be focused on the urology aspect. Diagnosis, nephrological follow-up, first-line management, and how to manage recurrent symptomatic UTI and vesico-urethral reflux. The second one will be held by Professor Ray Nyman and will be focused on classification and pathophysiology. We know that neurogenic bladder is a neurogenic detrusor sphincter dysfunction due to a lesion at any level of the nervous system. Of course, we will discuss about the spinal dystrophy related lesion and how to manage this kind of lesion to avoid renal function deterioration and to improve quality of life. We will discuss about the spinal pathways involved in micturition and the different pattern of dysfunction that we could observe and have to manage, where there is to define low risk and high risk dysfunction. The hereditary bladder need to be managed and defined with different exams, and the mainstay is the urodynamic study, and Professor Reinheimer will present the standard of ICS and the ICCS, how to perform the exam, and presenting the different exam, focusing on the gold standard that is urodynamics. Other point that will be discussed is the timing of this examination. The fourth webinar will be focused on urinary tract infection and vesicular management, and will be held by Professor Ramon Stein from the University of Mannheim and Professor Giovanni Montini from the University of Milan. We know the relationship between the bacterial virulence, bladder dysfunction, reflux, and the different infection. And we know that it's common to observe in patients with treatment with clean intermittent catheterization, bladder colonization by mucous flora. We will discuss the prophylaxis and the role of the prophylaxis in the different form of bladder dysfunction. Other topics will be the management of secondary vesicular reflux observed in children with spina bifida. The fifth webinar will be focused on CIC anticholinergics and will be held by Professor Rafał Czartan from the Jagiellonian University in Krakow, Poland. We know the advantages, the efficacy of early treatment with a clean intermittent catheterization, but we know also the difficulties about this treatment. The difficulties also related to accept this treatment by patients and caregivers. And we know that there are different modalities and also different modalities that could be related to difficulties to obtain catheter. Difficulties that are common to all countries around the world due to economical reasons, access difficulties to catheter, need for education, lack of specialized nurses for training. We know also the difficulties related to adolescents and the low adherence in this age. Other topics that will be discussed is the anticholinergics role and the different treatment where we know that there is excellent level of evidence for the efficacy of anticholinergics. The sixth webinar will be focused on the neurogenic bladder and renal function and will be held by Professor Montini and Professor Maternik by University of Gdańsk in Poland. We know that kidney damage is the single most prevalent cause of morbidity and mortality, even in children. The incidence has changed over the year, but they still high, and an early identification risk factor may prevent renal damage. This kidney dysfunction will be related to high blood pressure, recurrent UTI, stones, kidney dysplasia. We will discuss about the predictor of upper urinary tract damage. And the seventh webinar, the last one, will be held by Professor Jessica Della Belda that will present the individual rehabilitation project that is required in this patient, focusing, of course, on physical rehabilitation. But we know that we have to consider disability for all the aspects, comorbidity, mobility, and function, patient-related motivation design, etiology prognosis related to different levels, and also social and economical situation. We hope that you could enjoy and appreciate this webinar in order to promote other webinars according to your suggestion. Webinar that could be focused on neurogenic bladder surgical treatment, fertility, preservation, and genital aspect. Thank you very much for your attention. Thanks.
Вітаю, колеги. Вдячна за можливість поділитись своїми думками щодо проблеми Spina Bifida і проблеми мультидисциплінарного підходу до Spina Bifida в Україні. Маю велику радість і приємність бути членом найкращої педіатричної команди Хмельницької міської дитячої лікарні. Це найбільша дитяча лікарня в нашому регіоні, яка щорічно обслуговує понад 11 тисяч пацієнтів маленьких і так само має понад 250 тисяч відвідувань у нашій амбулаторній службі. А також не менш крута команда OMNI-мережі України, яка об'єднує 6 регіонів, щонайменше 4 клінічних координатори та 8 веб-сайт-координаторів. І центри OMNI-мережі знаходяться, як правило, в крупних клініках, які забезпечують надання допомоги матерям та дітям. Зокрема, це Волинський перинатальний центр, який уже об'єднався з Волинською дитячою лікарнею і створили потужний центр Волинське обласне об'єднання материнства та дитинства. Це Хмельницька дитяча лікарня разом із Хмельницьким міським перинатальним центром. Це Рівненський діагностичний центр. Ну, і це, на жаль, наша біль сьогоднішня. Це так сьогодні виглядає Херсонська обласна дитяча лікарня, яка надто постраждала від воєнних дій. Одним із видів діяльності OMNI-мережі є впровадження популяційного моніторингу вроджених вад розвитку, який відразу задумувався як активний і такий, який впроваджується з використанням міжнародних стандартів. Власне, це і дозволило згодом реєстру Рівненської та Хмельницької областей представляти Україну в системі EUROGEN. І перші ж результати, які ми отримали і які були продовжені і були підтверджені впродовж наступних років, нас, звичайно, шокували, оскільки Україна зайняла сумну пальму лідерства стосовно частоти вад невральної трубки та Spina Bifida, зокрема. Як ви можете бачити, рейти вад невральної трубки в Україні майже вдвічі перевищують середньоєвропейські і дуже суттєво відрізняються від багатьох інших європейських рейтів. Більше того, ця діаграма показує, що, на жаль, ми не спостерігаємо жодної тенденції до сталого зниження частоти вад невральної трубки в Україні. І розуміючи цю проблему, розуміючи, що вади невральної трубки в Україні є найвищими в Європі, і вони, на жаль, є стабільно найвищими, те, що вади невральної трубки є провідною причиною дитячої смертності та важкої інвалідизації, розуміючи те, що Україна щороку втрачає майже 1000 дитячих життів з причини вад невральної трубки, і цю кількість можна зменшити щонайменше удвічі, розуміючи, що існуючі рекомендації для жінок стосовно профілактичного вживання фолієвої кислоти також не дуже добре працюють, оскільки все-таки достатньо велика кількість вагітностей залишаються непланованим, а попередження вад невральної трубки є економічно доцільним, оскільки кошти на фортифікацію борошна фолієвою кислотою в 20 разів менше коштів, які суспільство затрачає на надання медичної допомоги. Безумовно, це також нас спонукало бути одним із лідерів в просуванні прийняття закону про впровадження обов'язкової фортифікації фолієвою кислотою в Україні, базуючись на досвіді уже понад 80 країн і розуміючи, що Україна є одним із найбільших у світі експортерів зерна. Як ми розуміємо, проблема спіна біфіда – це надзвичайно складна і багатопланова, багатошарова проблема, яка зачіпає не тільки медичні аспекти, але й цілий ряд педагогічних, соціальних і інших моментів. Тому мені вважається наша дружна команда, яка працює з проблемою ват-невральної трубки тут в Україні і з проблемою спіна біфіда, вона мені все-таки виглядає як такий великий жвавий вулик з багатьох бджілок. Бджілки, які займаються пренатальною діагностикою, генетики, нейрохірурги, неонатологи, які першими приймають діток, лікарі, які беруть участь в пренатальних консіліумах, ортопеди, психологи, урологи, ну і нарешті батьківські групи підтримки. Всі ці, я боюсь, що я, мабуть, не всіх іще перерахувала учасників цієї команди, але тільки спільні узгоджені дії можуть показати доволі високий результат. Коли я дивлюсь на цих бджілок, у мене ще виникає інша асоціація сьогодні, тому що мені українці сьогодні нагадують от таких бджіл. В нормальному житті вони є активні, працелюбні, але коли на їх вулик посягає хтось, коли на їхню свободу і честь посягають, то тоді вони вміють так само дружно надавати відсіч. Зокрема, у нашій лікарні існує команда, яка щільно працює з пренатальними діагностами, у проведенні пренатальних консіліумів, оперативному втручанні з приводу спіна біфіда та різноманітні види реабілітаційної допомоги, яку ми можемо надавати у наших закладах. Але чорний день, 24 лютого 2022 року, перервав дуже багато наших життєвих планів і поставив перед нами абсолютно інші виклики, з якими ми не думали, що ми коли-небудь штовхнемось. Це і перебування наших діток в укриттях, це травми, які абсолютно були несподіваними. Це і ампутації кінцівок, це і травми хребта, які ми бачимо у дітей, і це досить складні умови, в яких доводиться працювати нашим фахівцям. Водночас іще виникають питання і психологічної. Діти живуть під бомбардуванням. Хмельниччина, у Хмельницькій області є Хмельницька атомна станція. Вона знаходиться в 100 кілометрах, приблизно 100 кілометрах від міста Хмельницького. І це також ще одне джерело нашої тривоги. А ось коротко вибрані дані про те, скільки разів Хмельницький піддавався бомбардуванням, російським бомбардуванням. А 23-й рік. Це майже постійні бомбардування і майже постійне перебування дітей у сховищах. Зверніть увагу на цю карту. Вона показує, скільки разів, як рухалися безпілотні апарати з бомбами, як рухались Україною. Зверніть увагу, їхній переважний маршрут. Безумовно, в таких умовах працювати є досить складно. Війна – це взагалі жахлива річ. А якщо говорити про дітей із спіна біфіда, то дітей з особливими потребами – це ще набагато більший виклик, з яким ми штовхуємося. І попри всі проблеми, ми мусимо зараз допомогти нашим дітям. Частина із дітей стали вимушеними біженцями у Європі, і ми дякуємо щиро європейським країнам, які прийняли наших пацієнтів щиро і які допомагають їм у багатьох напрямках. Але частина дітей залишається тут, і у них є дуже багато життєвих конкретних проблем. У наших діток із пацієнтів із спіна біфіда є чіткі проблеми, потреба в урологічних катетерах, у них є проблема у психологічній допомозі, є проблема в ортопедичних моментах. Тому, якщо ви потребуєте, ми шукаємо добрих людей, які могли би допомогти нашим дітям. І наша головна ціль, безумовно, це запобігти і надати опіку пацієнтам з вадами невральної трубки, спіна біфіда, зокрема, але ми потребуємо вашої допомоги, як персональної, так і інституційної допомоги. Тому що цієї допомоги потребують наші маленькі пацієнти. Дякую. Thank you to speakers for giving the introduction and the outline of the activities and for making this webinar series possible. And now it's my pleasure to invite you for the start of the topic-specific webinars starting early next year on January 18. For this, you will receive an invitation and we very much look forward to seeing you then. Let's see the topics of the upcoming webinars again.
So Zymac, for your presentation, very, very useful, and because I believe that it's very important for all of us to understand the situation, and your presentation was very, very clear, because as you represented, the standard of treatment in Ukraine is very close to our standard, and of course now you have this terrible situation that has changed all, and I believe that for our next speaker will be very useful to know that in order to address at a better way their presentation. And some concern are concern of all countries, and of course in emergency situation these concerns are increased because, for example, we know very well that the one concern that every one of us meet in the daily clinical activities is the supply of catheters, because it's difficult to obtain in every countries, and we know that the best treatment is to single-use catheter with a clean intermittent catheterization. But in Italy and in other countries of Europe and the United States and worldwide, we know that for economical reason, people has to reuse catheter and to do something different respect to the guidelines recommendation. And this could be true for every aspect. And for this reason, I believe that step by step, webinar by webinar, will be useful to know each other, and in order to understand how to improve the treatment. You have seen previously in my presentation the topics. Mainly, most of the topics are related to the treatment of a neurogenic bladder. And why neurogenic bladder? Because in neurogenic bladder, best treatment, we will be able to preserve the renal function, and we will be able to improve the quality of life. But if we have the idea to improve the quality of life, improving the continence, urinary continence, we know that we have to treat also the bowel continence, improve the bowel management. And so in the future, for example, another topics that we could discuss together could be the bowel management of people with spina bifida. And of course, discussing about the pharmacological treatment, but also talking about the advantages of the physical activity, the diet, and the water supplementation, and also the other treatment as a transanal irrigation, because we know that we can perform rehabilitation of the bowel and not only surgery. And we have to discuss, you represent the needs for the orthopedics, and we have to discuss about the spine surgery, the spine treatment, but also the rehabilitation treatment for scoliosis, because we know that is very important for these children, and all the or functional orthopedic treatment for retraction and how to reduce this risk, how to treat the hip displacement, and also we have to treat some aspect for the that could be very important for all patients, for all people, but for all families. And I'm thinking about all the aspect of sexuality and fertility, because it is a topic that is, of course, very important and is a strong request that we receive by adult patients with spina bifida. But we know also that this point is something that is very important for parents, for relatives of a young child with spina bifida, because for every relatives it's important to know what will be the future of their child and what to do, and in the future what could be the life in adult life. And so I repeat again, but please, I would like to ask to all the participants of this webinar and the previous webinar, and again, step by step, we would like to receive your suggestion. Of course, question now on this presentation are welcome, but maybe this webinar too has been a presentation webinar, and we don't have so many questions. I don't see a question about technical aspect, but I believe that in the for the next webinar will be useful to receive your suggestion, your request, because we are here and we are a team, a multidisciplinary team, and Western Union, a specialist healthcare provider, and Ukrainian and healthcare provider, and I believe that we have to work and together in order to be all satisfied at the end either of this first series of webinar, but also at the end of other webinar that we have to planning together. So I don't know if you would like to close, Dr. Zymac, and thanks for this opportunity, for this fantastic organization. I would like to thank, first of all, OMNI-NET for the support and organization. And of course, I would like to thank all the technicians of EUROGEN and Darren, first of all, Darren Sheehan for this fantastic support, and also the other partner, and ITHACA, International Federation of Spina Bifida. And I hope that in the future we will able to do something very useful for all, either for Ukrainian children, but also for all healthcare providers in Europe, including Ukrainian healthcare provider. Thanks, and Happy New Year, because we will see the next year. Dr. Zymac, the podium is yours for the closure.
Thank you, Professor Mosiello, for this amazing introduction and for making this series of webinars possible. And thank you all speakers and all participants and all partners. And our best wishes with the upcoming seasonal holidays, and may the new year bring us peace. Looking forward to see you all in 2024. Goodbye.
Bye, thank you.